So first of all, welcome to this program that we have been doing for a number of years, and I'll share with you a little bit about what we've been doing. So I hear that there's supposed to be up to about 70 people. I'm not sure how many people are here at the moment, but it doesn't look like we've got that number yet. But it's okay. What we'll be doing over the next few hours, almost 8 hours of training, is that hopefully we'll be able to go through a number of activities which I'll share with this, which I hope that by the end of it, we'll be able to be fairly competent and confident to provide smoking cessation treatment. Yeah? So, are we good? Okay, so now I've got a problem. I've got no picture on the screen. I've got this thing in the middle of this we had the last time around as well. Thank you very much. Here's the better. Okay, so for today's agenda, I think the theme really is, the theme has been consistent over the last decade or so that we've been doing this, is really trying to empower every healthcare provider, one healthcare provider at a time. Yeah? And I'll share with you a little bit about what we've been doing over the last 10 years, just to get you into the scene and the mood of what you'll be expecting over the next few hours while you're training with us. So it looks quite busy, but I hope that due to the activities that we've got ready for you, that you'll be able to, embrace it and hopefully be with us for the whole period of time, so that you'll be able to get that level of knowledge and, more importantly, the confidence to provide cessation support. You'll notice that there are some thought sessions where we'll be sharing with you knowledge, and then there'll be some practical sessions that will allow you to practice some of the knowledge that you'll hear this particular moment. So together with me is a new group of colleagues and some older group of colleagues as well. So we've got with us public health specialists, we've got with us family medicine specialists, we have with us as well as pharmacists. We have with us also a number of colleagues that have been involved with stroke over the last 2 years, 5 years, 6 years, and also up to a decade already. So we've got a whole group of facilitators over the course of the day that will be able hopefully to help you to be a bit more proficient in providing that level of knowledge. So just to start, the scope training program that you'll be embarking is now a decade old. It started in 2015. I'll share with you that it has a history from 2012, and it is really in response to the gap of Empower offering support. Yeah? So you'll notice that the MPIT services started in 2015, and then we launched it in 2016. And I think we have here a picture of who's now with us in front. This is a decade ago. You see she hasn't changed, at least in her looks over the last decade or so. And of course, Dr. Fariza might have been with you, some of you, yesterday afternoon. So we have these number of people over the last decade that have been working together tirelessly in making this possible. Now, if you're not aware, the MQuid agenda looks like this. Yeah? So prior to 2015, we've always had groups that were doing prevention work in the public health sector, and we've also had groups that were doing cessation works both in the hospital-based and the clinic-based. And we also know that around this agenda, we've had the pharmacists working with us in providing cessation in the community pharmacy setting. But unfortunately, during this period of time, we were not communicating with each other. So MQuid was designed to assist and improve on the connectivity between the public health group and the cessation group. So as a result of that, we looked at 5 items. We looked at empowering or improving the quit smoking clinics. At that time, there were 50, but there was only one that was active in the ministry. There was scattering amount of facilities that were provided by the community pharmacists. Definitely, there were not many doing that work in the private general practice clinic, and almost none in the dental clinics during that time. So the idea was to empower and uplift those quit smoking services. The second one was to provide treatments that were evidence-based. in 2013, all the makers of quit smoking products wanted to pull out from the market because there was no demand on it being used at that time. So we wanted to ensure that at least there was enough quit smoking aid that was available, and more importantly, to uplift the treatments that were evidence-based that were not pharmacotherapy, for example, behavior therapy. So this was the other objective. The third one was to update the CPG at that time. So the clinical practice guideline in 2012 was using the 2006 guideline, which was never improved yet. Right? So we wanted to uplift that as well. And then of course, we wanted to train individuals with the guidelines that we had already made during that time. In fact, the guideline was 2003, not 2006. 2003 guidelines, which at that time was a guideline that I remember using when I was a medical officer. And I came back from my training and we were still using the same guidelines. We wanted to improve on that. We wanted to improve on the training, and we wanted to provide a quick line to the country during the earthquake services. So in response to that, we developed one of the now 5 training, accreditation training centers around. So one of them is Prof, there's the CSCSP, there's one at the Ministry of Health, and then there's a new one I think that was done by one of the pharmacy groups as well, in response to the CSCSP. And then there's a provider called Echo Training, which also provides it. So we're one of those 3, but we were one of the first 3 that were actually there. And this is what was done based on the work that we did, looking at the knowledge, perception of colleagues in all fields, with dentistry, pharmacy, medicine, which showed that there was a gap. And we improved on that the training with the dentist to eventually become the training that you will be embarking on today. And as I mentioned just now, it is in response to the O of empower. Now the scope training that you are receiving today, if you had trained in New Zealand, it is not the same as the one in New Zealand. If you plan to train in New Zealand, it will be the same as the one that we use in New Zealand, and also some modification with the ones that were used in the NHS. So we have colleagues, Professor Chris Bullen and Professor Hayden McRobbie, who advises us on the scope training, and therefore there's some synergy between our training and the international training as well. Now, as I mentioned just now, there are a number of parts of the training. There are a number of thought parts. There are some practical parts. There's also a role-play part. Now, the role-play part really wants to not connect, but wants to allow you to be able to be the actor and actress that you want to be. Dulu mak kata jangan berlakon, masuk medical school, dental school, pharmacy school. Sekarang bolehlah you keluarkan bakat tu nanti after you have at least a little bit of knowledge on how to handle bakat-bakat terpendam. Yeah, in our experience doing this for the last decade or so, some of you have become macam ada this demon inside you that wants to come out. So you become the worst smoker ever. Yeah. So the colleague who is practicing to be a healthcare provider that wants to help you to quit really struggles to handle this plus, which is even sometimes worse than or even more than the smokers that you see in our normal day-to-day. But nevertheless, it does allow some of that knowledge that we want to learn today to be able to be expressed. And then we'll look at some skills that we might be able to introduce to you in order to handle what can't wait to come out at the very end. And surprisingly, just as an FYI, when we did the feedback sessions for this, a number of you said that there's just not enough time to do role play. So even though during the time we often would like a lot of participation, with some of you are very shy in the initial stages, but when we have the feedback, you say there's not enough room. So sometimes I'm a bit confused on how we would like to navigate this. Right? But we'll see how it is for this team today. Now, this scope training that you are embarking on, has already been studied extensively. In fact, the primary researcher is with us, Dr. Siddiq. And what we found that despite the fact that some of you might think that it's quite a short training, just a bit, the research suggests that even in a day, you're more likely to be proficient in providing treatment support. And if you own your own pharmacy or your own clinic, or you have bosses that are supportive of you, you're 6 times more likely to succeed in providing the cessation work as a result of the training that you'll be embarking on today. Yeah, and I think that's really encouraging. In fact, we did another study looking at all of you over the next few months, and we see that the level of confidence, the level of skill proficiency increases over time after the training program. So we hope that this data stays true, and all of you today will also be able to receive that kind of benefit for your future development in this field of cessation treatment. So I think with that, I'm going to end over here. I hope that, like I said, you enjoy your time with us. We have like a very experienced panel of speakers with us this particular morning and this afternoon. We hope that we'll be able to convey all of our knowledge to you. Please feel free to ask. I know within us there are already some specialists, some specialists here. We shouldn't name the names here. So some of us will be ready for very difficult questions maybe. But nevertheless, I think we are here to improve our knowledge. We are here to improve our skills. And definitely having questions improves that. So I hope that all of you will have a great time in the next few hours. So with that, thank you, and we'll continue the conversation with the first speaker after this, and we'll start the training session. Thank you.